When and where to use massage gun. You're perfectly aware and maybe using this device, and it's extremely helpful. Now, when it's helpful, when it is not, and what the difference between this and that. That's the subject of our video right now, which guide you to what application of electric vibration beneficial for the patients and for the healthy adult. So two machines in the same part of the body will produce absolutely different clinical outcomes. My name is Dr. Ostruchininov. I am founder of Science of Massage Institute located in Phoenix, Arizona, and in this short video we will discuss very important issue, which is usage of massagers in the clinical setting. This device, which is extremely helpful and is excellent machine, became popular in the last maybe 5-7 years. It has its niche of application. Mistake is to use this machine in all cases of somatic rehabilitation, and that is need to be correct. What we'll discuss, niche of application, when it's really helpful, when it's actually working against the patient. Okay, so let's discuss what the difference between this and this machine. And I think the simpler way to show you difference is to turn them on. As you can see here, these are implications of each machine. That machine produces vibration as a result of percussion. This machine produces true vibration, and they're both equally important, but each of them have their own niche of application. Let's start with this one. So as you can see here, there is direct percussion impact on the soft tissue. Both machines works with the same receptors in the human body which detect vibration. And these receptors called Pacinian corpuscle. And the Pacinian corpuscles is very kind of strange receptor. In the what sense? First of all, it's called a rapidly adapted receptor. It means that every time when the percussion happens, every time when it hits the tissue and then lifts itself up and then again hits the tissue, at this moment there is enough time for the Pacinian corpuscles to actually adapt themselves, and every hit of the soft tissue, Pacinian corpuscles process as a new stimuli. What machine does, it stimulates the muscle and it stimulates fascia and actually activate receptors control muscle function. So from that perspective, when it's supposed to be used? In the cases when patients has, let's say, muscle atrophy after the surgery, peripheral neuropathy after the stroke, you have healthy large muscle mass in the healthy person who are not suffering of any discomfort. That is extremely helpful machine. When you put this machine on the patient who has pain and somatic dysfunction in the form of active trigger points, myalgilosis, hypertonus, or scarification of the fascia, what it does, it actually stimulates the muscle instead of inhibiting muscle activity through the Pacinian corpuscle. So Pacinian corpuscles has another impact. You can inhibit them. And when you inhibit activity of Pacinian corpuscles, they inhibit segment of the spinal cord responsible for innervation of the muscle you put vibration on. As a result, spinal cord sends command to the muscle to relax. And that is called dual effect of electric vibration. Stimulation of the muscle, and in the same area, muscle can be inhibited by application of so-called true vibration, which is, as you can see here, there is no percussion. It is oscillation. From that perspective, if you look right now on the chart, these spikes are representing when the massager hit the tissue and lifts itself. So this kind of spike application represents percussion. In another picture, what you see right now, it is actually a right-left oscillation. Right-left oscillations allow you to inhibit Pacinian corpuscles, and they in turn will inhibit spinal cord, and the spinal cord will send command to the muscle to relax. So every time when the therapist facing somatic abnormality in the form of hypertonicity in the muscle, that is not correct treatment tool. That is correct treatment tool. And the frequency of vibration supposed to be at least 60 Hertz. So advantage of this specific machine, it has flexible stems and it's semi-soft because you don't want to traumatize tissue which already exhibit hypertonicity. So from that perspective, application of the true vibration is part of somatic rehabilitation, and it's vital part of somatic rehabilitation before trigger point therapy, before muscle energy technique, because it allows you as a first step inhibit activity of the skeletal muscle, and then the muscle will cooperate with the therapy. This machine is made by Hitachi. Unfortunately, this machine Hitachi stopped making. So they have, however, same machine with one head, which is called Magic Wand, and it is need to be operated not on the battery but on the outlet. That will give you 60 Hertz. It again semi-soft contact area, and then it produces true vibration, which part of somatic rehabilitation, and it allows you to prepare muscles for much more advanced and sophisticated therapy in voice trigger point therapy, muscle energy technique, and so on. So from that point of view, each machine has its own niche. It's mistake to use this machine in every case. It's equal mistake to use this machine in every case. This is stimulation of the nerve and muscle, that relaxation of the muscle before treatment starts. From the perspective of the healthy athlete or healthy sports enthusiast, if they don't have pain and dysfunction, that's excellent machine. It allows you to decrease tension in the muscle by mechanically working with the soft tissue, which generally helps. However, if the muscle in the spastic state, that is actually become counterproductive. Treatment-wise, it can bring patients some relief from the symptoms, but from the therapist perspective, it doesn't produce foundation for the therapy which you build up on, and that's what true vibration gives you as a part of somatic rehabilitation. For the healthy adult, large muscle mass, use that. That will be great. For the patient, old lady with lower back pain, don't use it, because that's what you're supposed to use if you would like to address treatment according to the patient benefits, not from the marketing perspective. If there is sports enthusiast or athlete after the exercise, you don't want to use that either, because you would like to actually take hot shower, you would like to stretch. If exercise is very intense professionally, you can use ice cold bath, for example. But generally speaking, you will use that next day after excessive exercise. You don't want to use it at the day of exercise. Myofibrils already have micro damage due to the physical activity. You would like the tissue to settle. You would like that debris clean, and next morning or afternoon, when you start to feel residuals of the previous training, that's when you use this, and that gives you additional improvement in your performance in the next day or two. If you want to decisively help patients in complex clinical cases, greatly increase your income, and partner with local medical communities, please click right now at the link below in description and join us for live medical massage seminars and webinars, and we will work together. Thank you, and see you in the future. Where will we use this machine? Patient has any pain and dysfunction in the muscles and in the soft tissue, for example, fascia. Every pain or dysfunction cannot be treated with massage gun. It needs to be entire system of control, including pain analyzing system, need to be calmed down, and condition of hyperirritability of peripheral receptors need to be eliminated or controlled in some degree. True vibration does that. When the muscle gets in spasm, it's not only shortening the muscle, it starts to irritate nerves, peripheral spinal nerves, which are located in muscle layer. And then using true vibration and relaxing the muscle layers and space between the layers allows you also to decompress irritated nerve. So in such case, it also reduces protective reaction brain form to deal with the nerve pain. Finally, if you will apply true vibration along the pathway of the peripheral nerve, so you will actually follow the, let's say, sciatic nerve or radial nerve. So you're actually following the pathway of the nerve with vibration along, and by doing that, you activate posterior corpuscles along the pathway of affected nerve, which decreases inflammation in the nerve, stimulate local metabolism, and let nerve recover quicker if the nerve was irritated and then was successfully treated, but the remnants of the nerve irritation still present. True vibration as a preparation for the successful somatic rehabilitation need to be used approximately locally for 1 minute. If you have active trigger point, let's say in trapezius, you place a massager into the trigger point, you hold approximately up to the minute, and then when you remove that, that's when you apply trigger point therapy. That's when you apply muscle energy, because what you do what? You decrease protective tension by desensitizing segment of the spinal cord responsible for innervation of the muscle. And that's the beauty of it. Now, when we use massage gun for the same purposes on, let's say, active trigger point, then the constant percussion will also desensitize spinal cord in some degree. But this desensitization is not so profound because it actually keeps spinal cord on the some level of awareness. You would like to put completely in sleep lower motor centers located in the spinal cord that they allow you to actually reset the entire system. So the massage gun does not give this option because it constantly stimulates and activates receptors in the soft tissue, including posterior corpuscles, and they're constantly hitting spinal cord segment with the data, which is completely unnecessary. So, to conclude, they are both exceptional machines, and you see I have both, which means that I use one machine or other machine depending from the clinical necessity. And this is the goal of this video, to explain to the therapist or to the people who are actually interested on the subject that both machines equally important, but each of them have its own niche of application. You cannot mix niches of application and expect outcome. So when we see and we follow the science, it gives us specific niche application which delivers. And that's what it basically, it goes to the one end. Can we deliver stable clinical results? Can we prevent new damage or dysfunction? Yes, but you use different machine for different clinical scenarios. I hope you enjoyed this video and you learn what actually helpful to the patient or to the healthy athlete, and you will know now what to differentiate and how to differentiate application. And if you enjoy video, please leave comments in the section below, and let's start conversation when we can enrich each other. And I hope we will see each other in the future. Let's work together to bring your practice to the new level of medical massage expertise and the clinical effectiveness. Thank you very much, and I see you in the future.